and congratulations on the birth of your baby. Having a new baby can be both exciting and stressful. The goal of this video is to help you understand your baby's special needs related to withdrawal. It will also show you how you can help your baby through the process of withdrawal. Women who take pain pills, methadone, Subutex, or heroin during their pregnancy can have babies that withdraw from these medications or drugs after they are born. These babies have Neonatal Abstinence Syndrome, or NAS. NAS is a specific set of withdrawal signs that occur when the baby is no longer getting the medicines or drugs from their mother's body. Withdrawal signs can start as early as a few hours after birth, but usually start within a day or two after birth. There are even a few babies that will start withdrawing when they are around a week old. Not all babies show signs of withdrawal. Unfortunately, it is not possible to predict which babies will have signs and which will not. Any baby can have signs of withdrawal, no matter what drug or amount they were exposed to. These withdrawal signs include having long periods of crying, being hard to calm, having stiff muscles, making jittery movements, breathing fast, sneezing, yawning, spitting, diarrhea, and weight loss. They may have red raw areas on their skin from rubbing against their blankets and may not sleep or eat well. Some babies will have 1 or 2 signs, while other babies will have more. The nurses and doctors will check your baby's withdrawal signs at regular times using a scoring tool. This tool looks for many signs. These scores help the nurses and doctors make decisions about your baby's care each day. Your baby will be scored just before they eat each time, but how your baby acts between feedings is included as well. It may be helpful to watch your baby being scored. Your nurse can explain what they are looking for. As the mother, you are very important in helping your baby through this process. Many babies respond to their mothers better than any other caregiver. There are always ways you can help calm your baby and possibly decrease their signs of withdrawal. Your baby needs a calm, quiet room with no bright lights and only a few visitors. Keeping them in your room may be better than the loud and bright nursery, but it is possible that your baby may need to spend some time in the nursery to be watched. Your baby needs periods of continuous sleep between feedings. It's really important not to wake your baby if they are sleeping, unless their doctor tells you to. Some babies who are not eating well may need to be woken up for feedings. These babies often prefer a firm touch to gentle stroking and do better with lightweight clothing and a blanket or swaddle sack, a pacifier, and extra time being held. They may be more calm if they are held in certain ways. Holding your baby skin to skin or giving kangaroo care can be helpful. If your baby is having a hard time settling down when being held skin to skin, they may do better with clothed cuddling. This is a way to put your baby's face against your bare skin, but keep their arms and legs swaddled to help them move less. A third way to hold your baby is in the C position. Hold them on their side with their hips and legs bent. This may help their belly feel better. If your baby is fussy, the vertical rock may help them. You can do this by holding your baby upright in your arms and simply rock your upper body forward. You could also bend at the knees as you rock. They usually don't care for bouncing or swaying. It is also good to hold your baby for long periods of time. However, it is very important to take care of yourself. If you become sleepy, please put your baby in their bed or ask someone else to hold them while you sleep. Never fall asleep with your baby in your arms or in your bed. Using any or all of these skills could help calm your baby. You may be able to help them have fewer withdrawal signs and could help them to be more content. For those of you considering breastfeeding, here is some more information. Most mothers are able to breastfeed their babies if they have been following a treatment program for some time. Very small amounts of your treatment medications cross into the breast milk and are passed to your baby. Your baby may have actually fewer signs of withdrawal if you breastfeed. But be aware that you should not stop breastfeeding quickly or your baby may have more signs. Make sure you wean them slowly from your breast milk when you are ready. Breast milk is not safe when mothers have recently taken illegal drugs or alcohol. Please check with your baby's doctor about breastfeeding. If you have hepatitis C, it is still okay to breastfeed according to the American Academy of Pediatrics. Babies that do not need medication to treat NAS will stay in the hospital at least 3 to 4 days and maybe longer. This will depend on how they are doing, as well as what drugs the infant was exposed to while in the womb. Babies that have lots of withdrawal signs may need to be moved to the special care nursery or newborn intensive care unit to be watched closer. If your baby's scores stay high, they may need treatment with medication to help with the withdrawal signs. Most babies are treated with methadone or morphine. Sometimes other medications may be added to help decrease withdrawal signs. Please ask your baby's doctor for more information about the medication that may be used. Babies that need treatment with medication will have to stay in the hospital longer. Most babies stay for 2 to 3 weeks, but some need to stay longer. This will depend on how well they respond to treatment. After your baby leaves the hospital, it is very important to go to all of your baby's appointments. They may have an appointment with a special doctor at the high-risk clinic in addition to their pediatrician. This follow-up is very important to monitor your baby's growth and development. When your baby goes home, their withdrawal signs should be better, but may not be gone. Babies can continue to have signs of withdrawal for up to 6 months. These signs should be milder, but your baby can have periods when they become more fussy. This is a good time to use the holding and rocking skills you have learned here. You have an important job in this process. Your baby needs your help. Remember to take care of yourself so that you can care for your baby. You are the most important person in your baby's life. You can make a big difference in helping them adjust to their new world.